All right.
All right, got
Good
coffee,
morning.
but coffee.
All right,
What,
Ivanova,
what
it's
Cook
10:05. Can I
County?
go ahead and get started?
Mhm.
All right, I'm going to go ahead and get started. Good morning, everyone. Welcome to our very first Advocacy Day of the 2021 legislative session. For those of you who don't know me, my name is Jeremy Norton-Paul, and I'm the Executive Director of the Washington State Developmental Disabilities Council. It's a pleasure to be here this morning, and my co-MC Ivanova will introduce herself in just a few minutes. But first, just a couple of quick reminders. One is that we are recording this event, so just keep that in mind. And that way we can share it with people who didn't have a chance to participate this morning. The other thing is that I think we're all pretty much Zoom experts at this point, but just it's always nice to remind people that to keep yourself muted unless you're talking. That way we don't get any background noise or typing or anything like that. There is a chat box, and so if you want to type, you can use that chat box to say hi to people, ask questions, share information or links. You can definitely use that. There's also, I think, sometimes there's a raise hand feature. I'm not sure if we have that today, but you can always put something in the chat box or raise your hand like this, and we'll make sure that we get to you. So anyway, it looks like we've seen people zooming in from around the state: Walla Walla, Bellevue, Spokane, living rooms, dining rooms, offices, all sorts of places. It's definitely a lot different than it was a year ago when we were all standing in a church together in downtown Olympia. But I'm glad that Zoom is available for us to do this. And I want to ask you real quick, how is everyone feeling today? Put in the chat box. How are you feeling?
I'm doing good, Jeremy Norton-Paul.
You're doing good. Perfect. Awesome. Anyone excited, nervous, hopeful? I want to see how people are feeling. You can use the reactions button. You can put it in the chat box. Paul's feeling good. Yeah, thumbs up from Anne. Who else? Anthony's thumbs up, feeling great. Kathy's great. Courtney's good.
Yes, I am. I do have a question too.
What's that, Courtney?
I do have a question. Since we're trying to close down all the institutions, we need more community residentials.
Yeah, same. I feel hopeful for that kind of stuff. Very determined, very hopeful. Looking forward to that kind of advocacy. A little tired, need more caffeine. That's great. Everyone's here. So I wanted to give a quick shout out to the ARC of Washington State and Self Advocates and Leadership. They are great partners to the DD Council, and together we're able to put on events like this. And with support from organizations and people like everyone here today, we can make this possible. And as you know, Diana is really the one behind the scenes making it all happen. So let's show some love to Diana. Use your reactions, your hands, your faces, the chat. Let's give some love to Diana for really making this all possible. Yeah, that's great. That's cool. Zoom has a little feature where I can see how many people have loved and are clapping their hands. It's like Facebook almost. Awesome, awesome, awesome. All right, and I also wanted to say thank you to our presenters. We couldn't have Advocacy Day if we didn't have experts and presenters here to share information and share stories and to help us understand the issues and tell us what we can be working on. So Scott, Randy, Melissa, Anne, Faith, Representative Wicks, Kathy, thank you all for being here and sharing your expertise with us. They're going to be talking about an issue that's very important to us all today. And when we think about the things in our own lives that are most important, one of the things that often comes to mind is housing. It's a roof over our heads. And we know it's incredibly important for us all to have a warm, safe, dry, supportive place where we can sleep every night and spend our days. And that's what really community residential support's all about, is helping to make sure that all people, including people with developmental disabilities, have a place in the community where they can be safe, supported, and live the lives that they want to live. And we know that's hard, right? Because there's issues of resources and funding and rules and regulations and policies, but that's why we're here. We're here to help make the system work better, and we're here to help make sure there's enough resources and funding for people who need it. So that's why we're here, and I'm excited to hear from our presenters. I did want you to know that at the end of our presentations today, we will have a 15-minute optional time for people to stick around and network and socialize and hang out with each other. So after the end of the presentations, if you want to do that, stay on the Zoom, don't hang up. I'm gonna let Ivanova introduce yourself real quick, and then we're gonna get right into the program. So Ivanova, you wanna introduce yourself?
Hi, I'm Ivanova Smith, and I am the chair of Self Advocates and Leadership Sale, and going to be a co-MC with Jeremy. And we have a packed agenda today. All speakers will be talking about different aspects of community residential. Also, I wanted to just point out the artwork that we did today. I drew some of this artwork in memory of Tony Hall, who used residential services and who has sadly passed away due to COVID this last Saturday. And so just for like a minute, just a little bit of time, if we could just have a moment of silence for Tony Hall, who was an amazing self-advocate and member of People First of Washington.
With the little kid.
Thank you for doing that real quick. He was an amazing person and he had done so much for the community. And so he will all be missed in our hearts today. I wish he would have been here with us right now. So now we will get started. Jeremy, take it away and introduce our first speakers.
Thanks, Ivanova. Well, and thanks for sharing your fantastic artwork and the beautiful photo of Tony. I didn't know Tony as well as some of you here did, but I met him a few times at Advocacy Days last year. And the two things I'll always remember about him is his kindness. Just from the moment you meet him, he's incredibly kind, and also his dedication to advocacy. And so I think that, he's definitely here with us in spirit. And I think, we're all doing what we're doing in his honor today. So thank you. All right, I'm gonna go ahead and get into our program here. First, it's my honor to bring up to the virtual stage Scott Livengood and Randy Hauk, who are both representatives of the Community Residential Services Association, CRSA, and they're gonna spend about 10 minutes sharing some information with us. So Scott and Randy, it's all yours.
Okay, this is Scott Livengood, just making sure you can hear me. And
Yep, sounds good.
Thanks. So I direct an agency, Alpha Supported Living Services, a nonprofit that serves over 200 individuals in supported living and group training home services across Snohomish, King, and Spokane counties. And I'm here today as one of the legislative co-chairs of CRSA, the Community Residential Services Association. So just sort of a overview of supported living. Supported living serves nearly 4,600 people, served across 140 plus contracted agencies, providing over 21 million staffing support hours annually. So often we just use the term supported living, but supported living includes community protection programs, group home, group training homes, and licensed staffed residential, which is essentially supported living for children up to the age of 20. So supported living continues to be funded just above the minimum wage, which is often our main issue, trying to get funding. Currently, we're funded to have a starting pay just about 3% above the minimum wage. Because of that, last year, supported living on average experienced 50% turnover, which is the fourth consecutive year that has been right around or over 50%. In comparison, the SOLA programs are funded over twice as high as supported living, and the RHC funding is 168% higher than in supported living. The result of this is higher wages and lower turnover in those state operated programs. So one of our primary focuses this year, especially in our meetings with the legislature, has been the impact of COVID-19 on providers and the individuals we serve. So over the last year, like you've seen across the state and across the nation, we had a large spike in the spring with new cases rolling out, and supported living was, pretty hard hit by that. By the summer, those numbers came down pretty low and had a really low trend line for quite a while. Then it started to tick up a little bit, and December had the largest number of client positives since the entire pandemic started. At our agency, I can tell you that the number of clients who tested positive during December equaled the entire previous 9 months. And a lot of agencies felt that as too. Across all the providers, across the entire state of supported living providers, we've had 637 clients test positive as of last week. And very sadly, 31 clients passed away over the last 10 months. It's been really difficult for families, housemates, and staff to go through all of this, as we needed to continue to push on, often without having any sort of memorializing the individual, and continue to provide the staffing support in the homes. The rates that I told you, with the number of clients who tested positive and the number of clients who passed away, when comparing to the general population, the positivity rate is twice the average of the general population. And the mortality rate of those who tested positive is nearly 3 times that of the general population. There's also been about 1,300 staff who work in supported living who've tested positive over that course of the pandemic. Even so, just in comparison, and it's on our position paper too, that positivity rate in supported living is 13.9, which is still below that of the RECs, which is almost 20% at this time. So I'm going to turn it over to Randy, who's going to talk a little bit about the impact of COVID on agencies.
Hi, I'm Randy Hauk from Community Living, and we operate supported living services in Asotin, Yakima, and King counties. And just like Scott said, COVID has created a huge emotional and physical toll on providers, clients, and their families. We definitely have lost far too many people to COVID, both staff and clients. It has added extra stress to clients and staff. People are just really afraid of what's going to happen to them. While on the same hand, others are don't quite fully understand the potential consequences of COVID and what it could happen. And so with all of that, it has created some unique challenges that we've never had to face before. Staffing during this time has been extremely difficult, and many providers have had to pay for things like hazard pay. That's cost thousands of dollars a month to pay for. Things like hotel rooms, PPE, and the hotel rooms are for staff to work in so they can go home to a hotel room instead of going home to their own home and bringing possibly COVID back to their families. So altogether, that's cost a lot of money. And on average, it's about $700,000, which is about $12,000 per client. Additionally, training requirements have also been an issue for us. We've had to convert many of our in-person trainings to virtual trainings at an additional cost. We've had to buy equipment to make that happen, so it'll be safe for people to train. We've had some training suspended for short periods of time, but have not had a clear message of what we'll need to make up versus what will be waived during this pandemic. And all this during a time when we've been absolutely struggling with our staffing. Scott?
So as many of you know, the vaccine rollout has started in Washington, and for supported living, we were part of Priority Group 1A, which means that it became available. They did start with the nursing homes and assisted living first, so the month of January is when it essentially rolled out to supported living providers. The state has made available through pharmacy partnership with Walgreens and CVS, the Pfizer vaccine. And so each location that you sign up, for the most it's offices or counties, you get 3 visits where they come for the entire day and do vaccinations, which all sounds perfect, but the struggle has been getting everyone to consent to it. The news leading up to this, was sort of blanketed with information about the vaccine, some correct, some not. So there's a lot of fear out there. And because of that, we're having some struggles across agencies getting people to actually go through with the vaccine. From a client standpoint, it's going much better. We're hearing from agencies, they're seeing, on average between 70 to 90% of their clients consenting and getting the vaccine at this point. Some have already received the second dose, but the majority have received the first dose and will receive the second dose in a little while. Staffing has been the main concern. We're seeing in talking to some agencies about 40 to 70% of the staff consenting and going through with the vaccine in the Western Washington area, while in Eastern Washington, we're seeing much lower. We're seeing agencies report somewhere between 10 to 40% of the staff going through. Obviously, we're hoping that will increase over time, but it's overcoming a lot of misinformation and fear that has been out there for quite some time. Want to turn it over to our lobbyist now, Melissa Johnson, to sort of give a budget overview and some issues in Olympia.
Great. Thank you, Scott and Randy. I want to welcome everyone and thank you for coming this morning. I am Melissa Johnson. I'm the lobbyist for CRSA, and I want to give kind of a little context of where we are in the legislative session, talk about the budget, and then highlight several bills that CRSA is either watching or has actually participated in testimony for. So we are in the fourth week of the legislative session, which means we are just about a third of the way done. So that's, I think, good news for all of us. And this is the long session, 105 days, where the legislature is doing many things, but the most important thing is to come up with their 2-year budget for the next 2-year cycle, the biennium 2021 through 2023. And they are already passing several bills related to the budget, and one of which that we are very happy about is House Bill 1378. This is what's being called the legislature's early action bill, and it's focusing on the federal funding through the CARES Act and other federal stimulus packages that is flowing to the states, and it's appropriating that money for the rest of this fiscal year, so from now until June 30th. And CRSA has been advocating and testifying in support of this bill because this bill continues the enhanced FMAP rate. So this is the enhanced rate that we've gotten from federal dollars for supported living providers to cover the expenditures due to COVID. So first and foremost, this is the hazard pay overtime, those related costs for our staff to make sure that we have enough staff that are working to support our clients. And then of course, other related expenses to COVID, PPE and other things. So we have had that enhanced rate all through last year, 2020, and it was unclear whether it was going to be continued past March. And so House Bill 1378, there is a Senate companion bill, but the House bill has already passed the House and was heard yesterday in Senate Ways and Means Committee. So that one I think should be very quickly voted out of Senate Ways and Means. I think Senator Billig has said he wants it to be on the Senate floor next week. So that is really, really good news for our supported living providers. So while that work has been going on, the work on the 2-year operating budget is starting to ramp up. So we are meeting with legislators on the Appropriations Committee and the Ways and Means Committee to highlight supported living's budget requests this year. And we have 3 asks in kind of 2 different buckets. The first is, again, the enhanced rate for those COVID expenditures. Looks like we'll be good through the end of June 30th, but we have nothing for the rest of this calendar year. So we are asking for funding to continue that enhanced rate through the end of December. So through this entire calendar year to help our supported living agencies cover those expenses. So that is one part of our budget request. And then our second request deals with the minimum wage inflation rate. Every year, minimum wage will go up with the rate of inflation. And our direct care staff wages, entry-level wage, is just hovering above minimum wage. So we need to ensure that our wage for our direct care staff is going up just like minimum wage is. And so we are asking for a 2% rate increase to cover that inflation rate so that we don't lose any ground with minimum wage. Unfortunately, the budget, the state's budget does not allow us to ask for anything larger than that. So we are not actually gaining any ground as far as our rate, but we will kind of stay where we are if we have that 2% rate. So we are asking for that for the next two years of the biennium. We have worked with about 15 senators. We have requested that they put forward our budget request. In the Senate, there is a formal budget request process that we have to go through. And so we have 2 commitments so far of our 15 senators that we've asked. Senator Kaiser and Senator Warnick are passing our budget requests forward to Senator Rolfes, who's the chair of Ways and Means. And we have about a dozen more requests out there that we're waiting to hear back confirmation. On the House side, they don't have that same kind of formal process, but we are continuing to meet with those lawmakers on the Appropriations Committee to elevate our requests and so that the House will be aware of it when they're writing their budget as well. We are also watching and participating in several bills of interest this session. So I'll mention just a few. House Bill 1120 is Department of Social and Health Services request legislation. And this bill is important to us because it provides DSHS some flexibility through rulemaking during a pandemic like we're in right now. One of the issues that we have had over the last 11 months is the training requirements for our staff. Last year, there was not an opportunity because of either time or the virtual nature of the continuing education classes. Our staff simply were not able to complete the training requirements. And so the governor, through the proclamations that he issued all last year, put those training requirements on hold. And so that is still in place, but what 1120 does would give DSHS the rulemaking power to establish rules so that during a pandemic or other state of emergency, there would already be that sort of contingency for continuing education and other training requirements that people would not have to meet those during that state of emergency. We are working to try to get an amendment that would actually allow DSHS to waive those requirements so that we don't have people that have to complete last year's requirements on top of this year's requirements. And so we are still working with DSHS and the legislature to see if we can get the bill amended to allow a whole, kind of full waiver of those requirements in rule. So that bill is on the second reading calendar in the House, so they could vote on it today. It's eligible to be voted on by the House. The other bill that we've been testifying on is Senator Kaiser's bill, Senate Bill 5268. This is a result of the Ruckelshaus report. Many of you, I'm sure, are either participated in or are familiar with the Ruckelshaus process over the last year or two around FirCrest, around DD advocacy, DD services in general. And what Senate Bill 5268 does for supported living is calls out our rates and asks for a rate study. This is something that we've been hoping for several years, to actually get a rate that is reflective of the cost of delivering care and services to our clients. So that rate study is included in Senate Bill 5268. Other components of the bill are caseload forecasting. Unfortunately, it does not include right now core waivers or supported living. So we have asked that that be included in caseload forecasting so that the legislature has an idea of what services are going to be needed in the future.
Melissa, this
yes.
is Diana. And
yes.
I noticed that Bonnie Cates has her hand up. She'd like to ask you a question.
Oh, I'm sorry. Yes, Bonnie.
I am I don't know. It work for people for Morningside, and I do businesses in scrim, and I cleaned a parking lot in restrooms and bag cinnamon twist and chips for people for mornings. And I clean a restaurant. That's it. My grandma's calling my mom. I live with my grandma, and I help. I also help at home, and I know I know the all about the pandemic. I don't like being stuck at home because it's the virus that's going on. It's people need to be able to go out and see the friends and spend time with other with I we can, it's hard for people that I have family members, other family, who have other family members that live way far away, like Seattle. They come in once a week to stay a night, but they can't do it because they are afraid to be exposed to be with us right now because they don't want to get us. They are afraid to expose us. They are afraid they have this uh this virus and will give it to us.
Thank you, Bonnie. You know, there's a lot of people just like you that are living in fear of going out and of visiting their loved ones because nobody wants to give COVID to somebody.
Yeah.
Thank you, Bonnie.
You're
okay,
welcome.
back to you, Melissa.
Okay, thank you, Diana. And thank you, Bonnie, for sharing that.
You're
all
welcome.
of us, I think, are feeling that same frustration that we can't see our loved ones and our friends as we would want to. So the two bills that we're again looking at, the House Bill 1120 and then Senator Kaiser's bill, Senate Bill 5268. We are also monitoring Senate Bill 5213. This is the bill that clarifies the role of the DD ombuds, an important bill for them. And so we're watching that one as well. So those, we have a kind of a full plate for this remote legislative session. And as usual, our focus is mostly on the budget, but again, these two policy bills are very important for us. So Jeremy, I think.
Thank you, Melissa and Scott and Randy. And I think we have time for one more question before we move to the next presenter. Josie, I see your hand up. Do you want to ask a question?
Yes, I heard Melissa talk about, I'm on the core waiver. Are you trying to expand the core waiver, or what's the core waiver?
Right. Thank you for that, Josie. So we're not, it's not expanding the waiver. It's making the legislature include the core waiver in this caseload forecasting. So the state does caseload forecasting for example, K-12 education, so that the legislature knows how many students are going to be expected each fall in our K-12 system. And we want them to do that same caseload forecasting for core waiver and supported living, so that the legislature actually can see what the demand is for our services and then do something about it. Because right now, they are funding for as much as they have available, and as far as funding is concerned, and not for how many people are actually needing these services. So that forecasting would show kind of lay bare what the situation is and what the legislature actually needs to fund.
And I won't get kicked off, right? Because I am on the core waiver.
Nope, this is not, this does not change anybody on or off. It is just a tool. Caseload forecasting is just a tool for legislators to use to have an idea of how many people need those services.
Oh, okay. I was just asking because you did mention the core waiver, and I'm like, I was gonna ask you a question about that because I am on the core waiver with DDA.
Right. So no changes to the core waiver itself. I want to make that very clear. I don't want anybody to
okay. I
nervous
was just concerned and wanted to ask.
Yeah, no, thank you, Josie. I'm sure other people had that question too.
It's always good to clarify something like that. It's really important. So thank you, Josie, for the question. And Melissa, Randy, and Scott, thank you again. And now I'd like to welcome up the next presenter on our agenda, who is Ann Creighton. So Ann, you can go ahead and unmute yourself and take it away.
Hi, everybody. Hey, this is really great. I'm learning a lot. Thank you so much for getting this organized. Again, I'm Ann Creighton, and I'm a parent. Our son Hans has been in the system for a while. He is 27, and actually he was at Furcrest for about 6 months when he was just 13 for a little while, and then we were in the program for the under 20 crew over in Bellevue, and now he's with community living over in Kirkland, and he'll be 27 later this year. And you know, I mean, I think my main role is really to talk about how staffing is so critical. It is just the most important part of the service for someone like Hans, who needs 100% support. He's nonverbal. He cannot use a communication device. And he really doesn't have a lot of hobbies or interests beyond interacting with his absolute favorite caregivers. So those caregivers are the key to his care. So in some ways, it's not very complicated. On the other hand, it's complicated because we've got to have the right kind of person in that job, who needs to feel like they're valued enough to be paid enough to stay in that job, because it is fulfilling. It's a very fulfilling job for the right person. So let's just make sure that we're keeping those payment rates in line with where they should be. I was really interested to hear about Melissa's the Ruckelshaus report. I want to look that up and understand a little bit more about that, because that's kind of in line with how you have parity in these funding levels for the different kinds of services, the RHCs, the SOLAs, or the more supported living settings. So anyway, we've got a complicated kid in the system. It's really important that those services are on a continuous basis, and that the right kind of people can be hired and retained to do these really critical jobs. So just want to thank everybody for letting me have a few minutes here, and I'm really interested for the rest of the program today. Thank you.
Thank you, Anne. We really appreciate you being here, sharing your perspective. And we do have a couple of minutes if there are any folks with any comments or questions for Anne. You can unmute yourself or you can type them in the chat box or raise your hand. Give it a minute. Okay, and Anne, if there are folks who are interested in getting in touch with you, would you? I'm sure you'd be happy to connect with folks with questions.
Absolutely.
Or comments.
Anytime.
Okay, great. Okay, well, seeing no questions, I'd like to move on to the next part of our agenda. I'd like to welcome Faith Chofty. I hope I'm saying your last name right, Faith, but correct me if I'm wrong. And so, Faith, you can go ahead and unmute yourself and present.
Let me take a few minutes and share what COVID-19 has impacted my life. Using the word COVID, letter C stands for contact. I have always been a hugger and a handshaker. I have been that all my life. So you can imagine how hard it was for me to adapt by a whole new lifestyle. Social distance, wearing masks. My DSP has helped me a great deal. Remind to by the 6 feet apart and wearing mask appropriately and making sure I have enough mask for my supply. O means outings. I have always been a very social person. I have enjoyed being out in the community, like going on trips. Like everyone else, I had to adapt to that too. My DSP has made me assure that I get out of my home. We constantly are talking about fun things to do, like walking around the neighborhoods and going on car rides, and picking up food from my favorite restaurants. Going out on these outings with her makes me feel like a healthy, positive during this pandemic. Letter V stands for vaccine. When the vaccine became available to me, my DSP ensured that I was informed about being vaccinated and that it would be appropriately, quickly, and efficiently. Letter I stands for increase. During the pandemic, my support has increased. I have really relied on her, on my DSP, not only for my daily needs, but my moral support too, as I continue to social distance through the resisting of having people in my home. For example, on Thanksgiving and Christmas, she tried her very best to make my Christmas special for me, since I could not see my family over the holidays. Letter D stands for disinfecting. I, as an individual vulnerable to COVID-19, I appreciate that through the hard work of my DSP, I have remained healthy. My DSP has worked with me to continuously affecting my home and to use appropriate control. With this affection, I have remained healthy and have not been hospitalized this year. This is not the case for my family that has been hospitalized because of COVID-19. So I ask the legislature to support a rate increase so I can get the support I need to remain COVID-19 effective. And that my DSP is paid appropriately for the incredible work she does to keep me safe. Oh, from my heart to all of you, sincerely, Faith E. Shopee. Love you all. Bye.
Thank you, Faith, so much for sharing your thoughts and your call to action and your story. And I loved your sign off too. So thank you. And we're a few minutes ahead of schedule. And so we do have some time. If there are any folks who have questions for Faith, or anyone who also happens to receive supported living support who wants to comment on what Faith shared, we have a few minutes before Representative Wicks is here. So go ahead and raise your hand or unmute yourself or put it in the chat box if you have something to say. Josie, you want to say something?
Yes, I get out with I don't call them DSPs, but I call them caregivers or staffs or friends. I don't really call them TSPs, but they help me get out, and I'm actually out and about with one of them now. So I survive with them, and they help me in my home and in the community. And I think that I would be really lonely and really not in the goodest of moods without them. So I support them, and I lean on them, and they really help me a lot. So I hope that we continue getting the supports we need with the ones that need it. So that's all I have to say about having a DSP or a caregiver or whatever you want to call them. They have different names, so yeah.
Thank you, Josie. And you're right. Yeah, whatever you call them, they are incredibly important for people to live the lives they want to live in their homes.
And they need to be paid a good wage, and
Absolutely.
It's a responsibility, because I'm a responsibility to them. It's different from working at a fast food joint or a restaurant business where you're just flipping hamburgers or serving food. There's no responsibility to that, but it's a responsibility to help take care of somebody, and they need to be paid a good wage to help me take care of myself. And so
Yep. We definitely got to make sure that they get paid fairly. If I had a magic wand, I would make sure that they're all millionaires. But if we can't do that, then we got to at least make sure that they're paid fairly. Carrie, I see that you have a question you want to ask.
Hi, this is Carrie, and I have a daughter in supported living. What I saw the other day, I was at the hearing 5268 hearing, and what I keep hearing from the folks that were on the committee that developed or that put forth the recommendations for moving into community-based living is there's lots and lots of focus on SOLAs. And so the message that I'm trying to get across is that we need a range of options in our community. We really do. But that supported living is about choice. It's not just a model, because they're calling SOLA supported living. And again, I'm not saying SOLAs are good or bad, but I definitely want us to say that supported living is a model, an inclusive model. At least I'm saying that, not saying what other people should voice. But I think it's important that we talk about inclusion and part of the community, and that it is not just a place to live, but it's a philosophy of providing inclusion in the community. That's all I wanted to say.
Thank you, Carrie, so much. Really appreciate that. I think we have time for another question. Bonnie, I see you have your hand raised. You want to say something?
Bonnie. That's absolutely right on that part.
Okay.
I
can't share anything.
There is. I am on the core wave myself, and I'm ready to be on a in a
Hi.
home.
Oh, feedback.
I'm waiting to live in on my own, in my own home.
We got feedback here with the phone.
That's all right. We heard you loud and clear, Bonnie. Thank you for sharing.
You're welcome.
I don't see Representative Wicks yet. But so what I think we can do is, if it's okay with you all, we can go ahead and move forward in the agenda to Kathy. And then when Representative Wicks is here, Ivanova can introduce her. How's that?
Okay.
All right, Kathy, you ready?
Sure. Good morning, everyone. I'm Kathy Murahashi, and I work at Community Homes. And Community Homes promotes and sustains quality housing for adults with developmental disabilities. So I've been asked to talk about adult family homes today. Just a little bit about adult family homes. So most adult family homes, the majority of adult family homes in Washington were created for the elderly. It was a model that in the early 90s, some families went together and said, you know, we don't have enough housing available for people with our sons and daughters or loved ones with IDD. Maybe we can take this model that's used for the elderly and maybe we can tweak it to work for people with IDD. And so several organizations started in the 90s to do that. It's not a service. Adult family homes are not a DDA funded service. It's something that comes out of Home and Community Services, and it runs through and is regulated through that system. Most of our folks with IDD rely on Medicaid to pay for their services, and so that's a way to do that through adult family homes. But a lot of adult family homes either don't take Medicaid or they only will take maybe one Medicaid client. So it's kind of challenging to make sure that adult family homes are well funded and so that they can be quality. And a lot of the adult family homes for IDD are nonprofits, and they rely on fundraising to be able to keep the quality high in those homes. So the thing you ought to know is, if you are thinking about, I want to move out and I'm going to call my case manager, or maybe you're a family member, and saying, I'm ready for my adult son or daughter to move out. DDA, if you call the case manager, they're going to say, let's look at an adult family home, and they're going to send you a giant list of adult family homes from across the state. And you're going to have to wade through that. And again, the majority of those places are going to be for seniors. And, you know, seniors are great, but for young people with IDD, that's probably not the best setting for them. You know, they want to be out in the community, they want to be active, and you know, they're not ready to put their feet up and wait for their life to end, so to speak. So you're going to get this big list, and then you're going to have to filter to find, you know, the ones that just serve IDD that would be appropriate for you. And you're going to come down to that. And there's not very many in Washington. I think there's less than 40 in the entire state that are IDD specific. There's 12 in King County, and I think more than half of those are community homes. So there's not very many. At the time, we have 25,000 adults with IDD living at home with their family member, you know, looking for, that would qualify for housing of some sort, and 13,000 of those are at home with their parents. So we know there's this huge need for housing and supports for individuals. So again, DDA will say your option is adult family home. And so, you know, on the Basic Plus waiver, adult family home is the only housing model that's formally recognized if you have the Basic Plus waiver. So that leaves you with not very many options. So adult family homes are a really good model when it's well done, and it's far less costly than RHCs and other models. But because of, you know, the lack of affordable housing, it's expensive to start. You know, there's a lot of regulations involved, and the rates aren't very high. It really keeps this model from flourishing. So a couple of things. There was a bill a couple of years ago, 5672, that was supposed to bring stakeholders together to bring good ideas about adult family homes together. And they had met for almost, I think, more than a year, and they had some great ideas. And at the end of the stakeholder thing, we got the report, and it basically said there were a lot of really great ideas. We're not going to do anything about them. So those were, you know, encouraging them to look at the recommendations made to legislators. Please look at the recommendations in 5672. That's the name of the bill, so that we could improve the lives of folks in adult family homes for IDD. One of the ideas is to maybe have a DD specialty contract that's specifically for IDD, and maybe bring that back into DDA, so we would have IDD specific homes. The other is, we're really worried, you know, the financial margins are really tight. So we're worried about there's not going to be any rate cuts this year. And then lastly, we say, let's advocate for adequate DD set aside in the housing trust fund, because we just plain need a lot more housing for people with IDD, and we're not even scratching the surface there. So so if with that, is there questions? Yeah. Ivanova, yes. I agree with you that some of the adult family homes can be very restrictive. That's why we really would like to see some of these information, some of these ideas out of the work groups, so that we can make the quality of life in those homes better, because our folks need to be out in the community and to have access to the community as much as possible.
So Kathy, I've got a question.
Yes.
And I missed a little bit of your presentation, but well, two things. If you could put in the chat the bill that you referred to that has the suggestions for adult family homes so we can find it, that would be great.
5672. I'll put it in there.
And what year? Or can we just search that?
You'd have to look. I think it was two sessions ago, but I'm not. It's after this year, everything's kind of fuzzy in my brain.
House bill or Senate bill, or does it matter?
It would be a Senate bill.
Okay. And then the other question would be, is I'm still trying to figure out how funding happens for adult family homes and why that money couldn't be used, you know, like in shared living or some other option.
So adult family homes are funded through Home and Community Services. So anybody with a disability or is elderly that needs help with activities of daily living and is Medicaid qualified are eligible for an adult family home. So it's broader than just IDD. So, you know, if you have a physical disability or other kinds of disabilities under Home and Community Services, our, you know, Community First Choice Plan, they can be funded. So the care assessment that you get every year, you know, when you live at home or in the community, you get hours. And with an adult family home, they convert the hours into a rate, and that's how they are paid. So in an adult family home, an individual would pay room and board out of their benefits, so it cannot exceed their benefits, and the rate is set. The room and board rate is set by DSHS if you're on Medicaid. So that would be paid by the individual, and then the personal care, you know, the rate, the provider would receive the rate based on the assessment for the individual. Does that help?
So this money comes from the feds, and I mean, why can't that amount of money, like the personal rate, be used in a shared living home or something?
So if you have personal care hours, yeah, you can use your shared living hours. Your instead of going in an adult family home, you can use your personal care to be in a shared living. Yeah.
But it seems like the rate is lower as I'm understanding it. Maybe I'm wrong.
For personal care, yes, it's a little bit lower when you're in the living at home or on your own, yeah, than it is in an adult family. Not hugely though.
Okay.
Other questions?
I don't really have a question, but I have more of a comment. And I mean, I've been in an adult family home like in the early, like in 1999 or 2000, when we just went into the year 2000. I would put an adult family home when I was about 19, 20 years old. And I didn't like it. And eventually they put me in a boarding home, which is a little bit different, but kind of the same concept. But I would be advocating for those who don't like being in an adult family home.
You know what? You're absolutely right. There's a lot of adult family homes that are completely inappropriate for individuals with IDD, and the quality is not great. And I will just say that flat out. What we're advocating for is that we do a better quality.
But I
specific
do
to
agree with
IDD.
you. It's probably the adult family home would probably better than being in like Western State or Faircrest or Rainier. I mean, I got my brother out of Rainier, and he's actually in supportive living. He never went into adult family home. But my brother, he doesn't talk much. He can tell you if he wants a sandwich or if he's hungry, but he can't make choices for himself.
Yep.
So me and my sister got him out of the Rainier school, which was really good for him. In the early 200, you know, when we went from the year 99 to
2000, you know.
Yep.
So I'm really happy for him and that he's in supportive living and he does receive 24-hour care where he's at. And
Yes.
that's a good living situation that he's in. But I would also be advocating for my friends who are in an adult family home who need to be in supportive living.
Yes, and I agree with you. We need much more in supported living. The point is that there's just not a lot of options, I think, for families. And for some people, adult family homes, when they're created specifically for folks with IDD, can be a good situation. Again, not all of them are, but we need more that are of the quality model. And hopefully by bringing it back so that they focus on IDD, you know, that we would have a separate from the kind of the elderly population, that we could improve that. Does that make sense?
Thank you, Josie and Kathy, for the wonderful discussion. Now we have a wonderful next speaker.
Ivanova?
Yes.
Ivanova, it's Melissa. Representative Wicks is here.
Yes.
And so I know she only has like another second or two to be on.
Okay, Representative Emily Wicks of the 38th Legislative District, welcome, and please introduce yourself. Thank you for being here.
Thank you so much for having me. I'm so sorry I was a little late. I think some wires got crossed between a few folks, but I'm just enjoying the conversation and proud to be part of this amazing group. I'm Emily Wicks. I represent the 38th Legislative District, Marysville, Tulalip, and Everett. I live here in Everett, and I am on the Transportation Committee, so I'm looking forward to providing all of Washingtonians, and especially those living with disabilities, with reliable transit and usable sidewalks. I'm really passionate about building those connected communities and supporting everyone. And also just supporting long-term care funding. And what I'm hearing today too is that, you know, our friends with developmental disabilities are, you know, looking for options that work for them. And so I'm excited to learn from you and to understand what our needs are, and so we can get all of those met. There's some great pieces of legislation coming through, and I want to be as helpful as possible when it comes to that. And I'm also working on a great bill around hearing aids, 1047, which would provide hearing aid coverage for children with hearing loss in their ear. With hearing loss, it would be $2,500 per child or per ear with hearing loss every 3 years. So we know how important that is for our learning and our growth and our development. And I'm really excited to champion this. We're working on that, but I don't want to take too much of your time. I'm happy to answer any questions folks have, and I'm just excited to learn more as I go through this. I'm a new legislator, was appointed in May, but kind of jumping in everywhere, and just excited to chat and be here and continue the conversation.
Thank you so much for being here. Does anybody have any questions for Representative Wicks real quickly?
I have a question for Emily Wicks. Since you're on the Transportation Committee, can you vouch for rural areas in the state of Washington? Since Tenano is one of those rural areas.
I think the question was about providing access to rural areas. Is that right?
Yeah.
Oh, yes. I'm really passionate about increasing our transportation access, and in everything we do, and any, you know, roads that we are building or improving, that we're putting transportation access there. I know, you know, a lot of people are really passionate about making changes to Highway 2, but one thing that's missing is buses. And so simply adding a road isn't going to do that. So there's going to be a huge component where we're working with community transit to make sure that we're connecting people all over the place. So that's going to be critical to getting cars off the road and everyone doing their part, and just making sure that we can get from our doctor's appointments to our homes, to the grocery store. And so, yes, I'm definitely passionate about doing that. And I look forward to hearing more about how we can do that and make it possible.
Any other questions?
I have a question.
I do have hearing aids, and I just got mine through my insurance. I mean, I freshly got it like I want to say August of last year. So I do suffer from hearing loss in one of my ears. I like to lay on the ear that I can hear out of. So the ear that I cannot hear out of is up. So I get a good night's sleep. And I can't hear a thing. So I mean, I can hear a little bit out of one of them. It's very, very, very slight, like 5% out of my left ear. And so I did freshly get one, but I cannot wear my hearing aids with these masks because I have enough behind my ear with the behind the ear kind of mold. So I don't wear my hearing aids with these masks, and that's a problem. And
Yeah.
I wish that we didn't have to wear these masks and I haven't been able to wear my hearing aids at my job because I work at the stadium, because my hearing aids are supposed to, in a loud place, are supposed to bring the volume down instead of the volume more up, you
Yeah,
know,
I
in a
definitely,
loud crowded space.
yeah, I definitely hear you. I'm deaf in my right ear as well. And I know, wearing masks and, having the shields and everything when I work and volunteer at the hospital is so hard to hear folks, and it makes it really difficult. And this is not the first time that I've heard that. And so hope, the hope is that we can get through this pandemic. I'm excited that vaccines are increasing and we're making those available. And hopefully we can find other options for folks that have that problem, because I'm right there with you. It's really challenging for those of us that are hard of hearing and that depend on hearing aids to get that. So I really appreciate you sharing that with me. Yeah, like I said, you're not the first one of my friends in the community who has mentioned that and that difficulty. But also remember knowing that we need to keep people safe and wanting to do that. And I commend you for being willing to be a little uncomfortable and make sure that you're protecting public health and others that you come in contact with. But let's continue to talk about other options for folks to make that a little bit more comfortable and make sure that we can still continue to hear.
This is Stacy. I have a question.
Yeah.
Representative Wicks, on the intersection of housing and a bill that's in one of your committees, Children, Youth and Families, House Bill 1061, regarding foster care youth with developmental disabilities who leave the foster care system as they age out between 18 and 21. We know that there's a tremendous problem with a lot of youth exiting into homelessness, and that they're often not connected with the DD system. It's a complicated system to be connected in to get residential supports. And so we're hopeful that you'll be tracking that bill and looking carefully at the amendments and thinking about the stories that you've heard today for youth with developmental disabilities who desperately need these residential options.
Thank you very much for that and bringing that up. I'm really looking forward to working that bill and passing it out of committee, and yes, being very thoughtful about the amendments that go through. This has been a huge issue in my community as well, and I'm not only this, but want to work on making sure we're helping folks and bridging that gap so that everyone can have a safe place to go and be cared for and get the needs that they deserve. And also, I've had so many teachers in the past that have worked with special students in my schools that are working really hard to make sure that we're better connecting the services as they're coming out of school. And this is going to be extra important for our foster youth that are aging out. So I look forward to working with you on that. And please share if there's any specifics or any thing I should be concerned around with certain amendments that are coming through. Please let me know. But I'm 100% supportive of the bill and its intent.
Thank you. Yeah, we
we would just emphasize that for foster care youth, they're not entitled to service. They basically go onto a almost 15,000 person wait list unless they meet a certain severity level. And so the idea that they might be prioritized for services and that both systems in DCYF and DDA would have enhanced case managers potentially to help navigate that tricky system would be super important. And those are part of the amendments. So thank you.
I agree. Yes, thank you so much.
Any last question? I'll let one more person ask a question to the representative. All right, I'm hearing none. So thank you so much for your time, Representative.
I do
Wicks.
have one more, Avanova.
Courtney has a question for you, Representative.
I
So
was
I'll let her
thinking
take it.
for buses, I was thinking we should do more data for rural areas.
I agree.
Because they do data out in the city, and I want that for the rural areas.
Yeah. Definitely. We have folks that need transportation all over the state, and I'm definitely going to be working on that, making sure we have more access and increasing our buses and our trips and our routes. Thank you so much, everyone. I really appreciate your time today and welcoming me in. And I hope to hear from all of you, especially those in my community soon, and getting to see you in person soon someday and connecting in that way. Be safe, everyone.
Thank you so much for your time, and have a wonderful rest of your day.
You too. Thanks for putting this together.
Yeah. So our next speaker is Diane Staden, and she will be going over our bills of interest. Take it away, Diane.
Sorry, but my mute wouldn't go off. Okay. Hi, everybody. I know that this Advocacy Day is really different than it has been in the past. It's hard not being able to join each other in person. It's been so difficult for people through this pandemic dealing with COVID-19. And we had the reality of this hit us last week when we lost Tony Hall to COVID. And so we're still going to do Advocacy Day. We want you guys to be involved. We want you to have a voice in the process still, even if we can't go down to the campus in Olympia. But it's still very important. There are policy bills and budgets that are going to pass, and we don't really like some of those. And so if you don't have your voice being heard, that could be a really detrimental thing this year. So Alex is going to talk more about what you can do from here, but I'm going to go over the bills with you, and I'm going to share my screen so that you can follow along with me. That is, if I can find them. There they are. So the first section of the bills goes over the budget bills. And we got two different kinds of budget, actually three. There is the operating budget, and that's where all the services for developmental disabilities and everybody else gets funded, is in the operating budget. Then there's the capital budget, and the capital budget is for buildings and things like schools and state institutions, which has been a big issue. We don't like the governor's capital budget because he wants to build a 120-bed nursing facility on the grounds of Fircrest, and we totally don't agree with that. So that is really important for you to make your voice heard about that issue. You want the places for people to live and be served to be in the community. And so it's important you tell your legislators that, so that when it comes up for a vote, they know very definitely that's not where you want our state to put the money.
Diana, this is Jeremy. I'm sorry to interrupt, but could you expand the size of the chart on your screen?
Sure.
Sorry to interrupt you.
Not a problem. Whoops, too big. Is that better, Jeremy? Let's see if I can.
Yeah,
remove-
I think that's good.
Okay, so in the capital budget, we do not want that 120 bed nursing facility. And it would cost them $120 million, $1 million for every bed just to build the building. That doesn't even take care of the staff to go in and work in it. So we don't want that part of the capital budget, but there's something missing in the capital budget. For people to be able to live in the community, they got to have houses there, someplace to live. And there just is not enough housing out there. And there's a part of the capital budget called the Housing Trust Fund. And the state gives money to places that build homes or remodel homes. And they're for specific groups like veterans. There's money just for the veterans for them to get new homes through that. Well, there's what we call the DB set aside. And that's supposed to be money just to build and remodel homes for people with developmental disabilities. And guess what Governor Inslee put in for it? Nothing, $0. No money for the DB set aside in the Housing Trust Fund. So you need to make your voice heard about that too, and let your legislators know this isn't right. You're going to build a 120 bed nursing facility, a new institution, but you're not putting any money for people who want to live in the community, which is where almost everybody does live or wants to. So those are budget things that you can have a say in by contacting your legislators. And on this bills of interest chart, it shows you all the budget bill numbers and which ones they are, whether it's capital or operating budget. There's just a few bills under medical and Medicaid. One of them was the hearing instruments that Representative Wicks was talking about, House Bill 1047, to get insurance coverage so kids can get hearing aids that need them. We have the one that Stacy was talking about, House Bill 1061, about kids who are in foster care. And when they get older and they age out of foster care, they wind up on the streets because nobody's doing anything to help them. But if they have developmental disabilities, they should be getting services through the Developmental Disabilities Administration, or DDA. Under education, there's a number of bills. One of them, House Bill 1153, that bill's been going for a few years now, but it hasn't ever been able to pass, mostly because there's a big fiscal note for it. That means it takes some money to make it happen, because there are a lot of kids in school who come from families that maybe they don't speak English as their first language. But the parents want to understand what's happening with their kids in their school, and they want to participate in this team meetings and stuff, but they need an interpreter or somebody to help them with understanding things that they should be able to know about. So being able to get that language access in public schools is really important too. Going down to Senate Bill 5237, and that one has what we call a companion bill, House Bill 1213. Means one bill starts in the House and one's in the Senate, and see which one they can get to make it all the way through the process, and so that it becomes law. So this is called the Fair Start for Kids Act. Especially with the pandemic, families have found out that it's really hard to get childcare and keep it. And they can't work if they don't have somebody to take care of their children while they're at work. Also, this bill talks about early learning or birth to 3 services, which are really important for kids with developmental disabilities in their early part of their lives. So this is going to enhance the money that they pay for those services and try and expand where we can get those services so there's more providers. Civil rights and legal. Now, one of the things that we've talked about today because this is about residential services. People who live in an adult family home or supported living or some of the companion homes, there's a lot of different types of residential. We've only talked about two basic ones today, but there are some others too. Well, when the pandemic hit and these places said, oh, we can't let anybody in because they might expose people to COVID. And so people lost connection with their families. Their family members couldn't visit them. If they didn't have any technology, they couldn't even see them through Zoom or something. So this bill would say that you got to keep a detailed client roster. There's got to be 24-hour access to families. When people need to talk to their families, that can stop a crisis from happening right there if they can just talk with their family members. And then in all of these places need to have a disaster plan in case something happens. So that's another bill that we're following this year. And one of the big issues for people with developmental disabilities is getting paid sub-minimum wage. In this day and age, that just shouldn't happen. People should be making minimum wage or better if they're doing a job. And so that bill's been getting hearing, and we're waiting to see what happens, and your voice can be used to help make that bill move along. We also have talked about Senate Bill 5268. And that came from the Reckles House report. And there's a lot of good things. It's not just one thing in that bill. There are a number of things. And so we have been providing input, and Alex is going to tell you a little bit more how to do that. But it's really important that your voices are heard on these bills. So one thing I want to tell you too is the cutoff dates. When we're in legislative session, you can have a bill that gets started, but the first cutoff date is February 15th. And so if the bill did not get out of its first committee, the policy committee, by February 15th, then the bill dies for this year. And if it has to go to a money committee like appropriations or ways and means, it's got to get out of that committee by February 22nd. So on the bottom of this budget list is all those cutoff dates so that you can know when they are. And I'm going to show you where to find that. Let me pull up.
All right.
This is our website, the Arc of Washington, and this is the Advocacy Days page. So when you go here, you can find all of our advocacy days. And like Jeremy said earlier, each time we have one, we post the video with it. So you can find the agenda of what we did today. You can find the handouts that we're going to give legislators. And you can register for next week for the employment supports or families, and register for all the advocacy days. But if you want to.
Sorry to interrupt.
Hi, Eric.
Hi, sorry to interrupt you right offhand, but a little correction from a while ago that you mentioned of Tony Hall and how that you mentioned about he passed away because of COVID-19. That is not true. That is not true. Yes, he had COVID, but he died from something that's a lot more about an infection that he had. He died because of that, not because of COVID.
Okay, thank you, Eric.
I'm sorry to interrupt you, but I just wanted to briefly tell you that now.
Yeah, Tony went into the hospital with COVID and then got an infection from there, and between the two of them. But,
right.
Yeah. Okay, and so when you go to our website, if you click on the Advocacy tab, you can come down here and you can click on the bills of interest, and it will pop up that chart that I showed you. You can also look for the budgets. There's the operating budget and that capital budget I told you about. And if you want to find out about hearings, they're also listed here. It gives you the next week of hearing schedules. So does anybody have any questions about the bills of interest? Well, if not, I'm going to turn this over to Eric.
I've got a question. In terms of the FERC and sending notes to our legislators about not supporting that, is there a timeline? What would be the best time to do that? When does that get voted on, or when is that considered?
That's a good question. Okay, so the way the budgets work is the governor comes out with his first. He did that in mid-December. And then when the legislators started up the session, they had a hearing in both the House and the Senate for people to testify about what they liked or didn't like in both the operating budget and the capital budget. So now, when we get into March, around the 20th, there's what we call a revenue forecast that will come out. And it will tell legislators what we can expect to bring into the state as far as revenue, as far as money coming in to pay for services. So right after that, usually within a few days, both the House and the Senate will release their budgets. They've already started working on, the budget committee is working on them right now, because by the time the revenue forecast comes out, they're pretty sure they have an idea of what they're going to be working with. So they've already started making their budgets and building them toward that number. And if they have to, they just shift the number a little bit before they release their budgets. But they're working on them right now. And so it's really important that right now you get your voice in there so they hear you and can share your voice in that committee. Does that answer your question?
Yes, thank you.
You're welcome. Any other questions? Okay, well, I'm going to hand it back off to Ivanova then.
Hello, and thank you, Eric, for that correction. Thank you. So next up, we're going to hear from Alex about what you can do for the rest of the day or the week for advocacy. And also, I will assist Alex with any follow-up questions. So take it away, Alex.
Hello, my name is Alex Motteller, and I am the current sale policy coordinator. With the current crisis, essential support staff are putting themselves on the line to protect and care for clients. Even when the clients have COVID, they need to report to work and do essential jobs. Whether clients are in supported living, an adult family home, or a state-operated living alternative, we live in crowded living arrangements. These are frontline workers who deserve a fair wage. We need to let our legislators know how important they are to our lifeline. These workers are essential as they help us with our activities of daily living. Your stories will re-empathize how important it is for us to get services. Here are a few things you can do to make your presence heard. Watch each Advocacy Day afterwards on our website. Email your legislators about bills that are important to you. You can email to get virtual appointments with your legislators. You can watch hearings on TVW to get information. You can sign in to testify at future hearings, or to sign in pro, con, or other, or submit written testimony on a bill. Attend future advocacy days every Wednesday during session end. Diana will share the schedule and you can find it on the website. Diana also sent you a one-pager for this week. https://arqua.org/advocacy/advocacy-days/.
So does anybody have any questions for Alex about how to be involved? Well, we'll let Ivanova wrap up our day for today. This Zoom link will stay open for a while, so if you want to stay on and chat with friends or ask questions, feel free to do so. Otherwise, I hope we see you guys all next week. Next week is Employment Advocacy Day. And of course, having a job is hugely important to everybody. So we hope that you will go to the Advocacy Day webpage and scroll down until you see February 10th, employment supports, and there's a Zoom link where you can register. And we'll hope to see you next week. Thank you.
Thank you. Just one more day. So if you are going to go to any bill hearings that are coming up this week or next week, it's really important to know. I actually had to learn this on Monday, but if you have virtual backgrounds of any slogans of your position for a bill, you cannot have that up when you testify in a bill hearing. So just be mindful of that. Don't have any, you can have background just like pictures like this, but don't have any slogans or anything that states your position, because the legislature actually doesn't like that. They said that they consider that disrespectful. So just be mindful of that when you put up a virtual background for hearings. I had to learn it the hard way, so it's just good to know that. So thank you. And if anybody wants to talk and chat, go right ahead. If you have any comments about that, go right, you can speak freely now. This time is for people to get to socialize and chat with each other. And thank you for being here today. And here's a picture of Tony Hall, who's epic. He was a really good friend of mine. I really enjoyed being his friend. And last year at Advocacy Days, we got to do advocacy together at the Olympia, and it was a lot of fun. And I'm really gonna miss that. Looks like Carrie has her hand up. Go ahead, Carrie.
For the animated film Soul.
Hi, this is Carrie. Sorry, I couldn't get myself unmuted. So my question is, we heard earlier about cuts to the DDA budget because of budget, or because of our state budget would be cut because we have lost revenue because of COVID. Does anybody know what's happening about that and anything we should be doing to advocate?
Hi, Carrie. This is Diana. Those 15% cuts that they were proposing would happen were based on a budget that was really bad after the state shut down from COVID. That didn't come to pass. Things have picked up and the state has more revenue coming in. And so they aren't having to make those cuts. But one of the things that legislators were committing to us in the virtual advocacy days we did in the summer and meetings since then was they were not going to cut DD services. They would find a way not to do that. And earlier, Melissa was talking about those two new budget bills, one in the House and Senate. One of them's, what it does is it goes back to 2020 through December 31st. And when the CARES Act came out, first we just took the federal money to match what we were spending then. But then the legislature realized if they take all the money out of the rainy day fund and put it all into DD and long-term care services and get a match for all of that as well, it would bring extra money into the system. So that's what those bills do. They wipe out the rainy day fund and put it all in DD and long-term care so that the federal match, we got to match all that money. So the state only had to use half their dollars. And then the second bill says, okay, we're going to do the same thing with from January through June of this year to make sure those enhanced rates and all the things that were taken care of would still continue to be paid, and we wouldn't have to worry about them because we'd have all that federal money coming in to help pay for it. So we were able to stave off those 15% cuts, partly because the economy got better, but also because some legislators got an out of the box idea to try and bring more federal dollars in to help with that.
Right.
Answer your
Okay.
question?
Yes, thank you so much.
You're welcome.
Oh, heaven.
Agonizing pain. His guards and nurses didn't believe him, leaving him to die.
I got it.
One investigative reporter did believe. This is the story of Kevin Wingo in today's True Crime Chronicles.
Anybody else have any questions or anything they'd like to say?
No.
Oh, Krista Monahofer had an announcement. The DD Ombuds is hosting an Emerging Leaders and People First of Washington Zoom room today from 1:30 to 3:30. So if anyone is interested in that, just get a hold of Krista Monahofer and she will send you the Zoom link.
I'm sorry, I don't have no more. I gotta go.
Okay, thank you, Bonnie. No problem.
Ivanova or Krista, this is Jeremy. Do you know, is the People First Zoom link always the same link for all the People First meetings?
I believe so, yes.
Okay, that's the one on the People First website, I think.
Yes, it's the one on the People First website. So you can go to the People First of Washington website and they should have the link right there to join that if you are interested. I won't be there because I will be doing my chapter meeting at that time for Pierce County. Oh, 2 participants have raised their hand. Robert Wardell, go for it, Robert. And then Krista.
My question is, you know, there's a lot of hearings. How do we know which ones for people with disabilities, which ones are not?
Well, that's a good question, Robert. And that, I think I'm going to share my screen with you again.
Because the last time I got some stuff, I didn't know which ones for people with disabilities. That's what I was worried about.
Well, and one of the things is we try and track just the hearings that have to do with developmental disabilities.
That's
So
what that's why I was trying to ask, because I'm like, I don't mind testifying, but I want to make sure it's for people with disabilities, not just.
Okay, well, every Monday you can go to our website and click on Advocacy. And if you scroll down here a little bit, it says committee hearing schedule.
Okay.
And so it tells you, these are the committees. I go through them every Sunday, go through all the committees and check their agendas. And any of them that have our bills in them, I put them on this list. And if they're getting a public hearing, then they're in yellow. That means that that would get public testimony there. If it's in gray, that means it's being exec'd out of the committee. It's passing the committee that day. And sometimes you'll see this teal color, and that means it's a work session about something of interest to us. like this Developmental Disabilities Administration budget overview. You can't testify at that, but you can watch, and they have panels of people that will talk about that to help educate the legislators on that committee. So and then if you want to testify, that's also on here. Right here in the blue underneath health and long-term care, you can testify on that bill. You can click here on this link and it will take you to the sign-in page where you select the committee and which bills you want to testify on. And then you just put in your information and then you send it off and they have you listed to do your testifying.
Okay.
Does that make sense?
Yes.
So just remember to go to the website, click on advocacy, and that will take you to those links. You'll be able to look at the bills of interest, the budgets, both the capital and operating, and the committee hearings.
Right. All right.
Thank you, Robert. Krista, you wanted to say something?
Yeah, I don't know how to, can you hear me?
Yes, I can hear you.
Oh, okay. So I am on my phone and I put 1:30 to 3:30. It's actually 1:30 to 2:30. And I wanted to make sure everybody knew to get, like Jeremy said, all People First items you can be found in the People First Zoom room, and the schedule can be found on the People First online page off of the website. So the links should always be the same. There will never be registration needed or any kind of IDs. So I'm hoping to see people there. And then tomorrow is our weekly session with David Lord, where he explains more about some of the bills that Diana was talking about. And people can research and then get some support to take action as well.
Ivanova, do you want to talk a little bit about the sale meetings where people can go to learn more about the bills too?
Yes, so Self Advocates and Leadership Sale, we have meetings on every second Tuesday of the month from 1 to 4 p.m. on Zoom. At these meetings, you will get to hear more information about the bills that we are working on and our legislative priorities. SAIL is fully led by people with intellectual and developmental disabilities, and we're really passionate about making sure that legislative policy respects our civil rights. And we sometimes have guest speakers come and speak on different policy issues that maybe we're not sure of or ones that we want to support. And so it's a great way to learn more about the legislature and what they're doing and what bills affect people like you and me. And you and me. And so if you want to learn more and you want to get involved, SAIL is a great place to do that. Just let Jessica Renner or myself know, and send us your contact information, like just like your email or anything like that, so that we can get you the Zoom link for our meetings. Also, you can find the Zoom link for our meetings at our SAIL Facebook page, Self Advocates in Leadership SAIL. So it would be great for you to join us if you've not joined us before. And we have a lot of great advocates that will help you out and be a support to you. And we're very inclusive. We want to make sure that everyone feels welcome at SAIL. So please come and learn more if you like. Every second Tuesday of the month. So the next one will be on February 9th at 1 o'clock.
And Alex is new to SAIL. He's the new policy coordinator, but I see that his screen is frozen up right now. But you can also contact Alex and let him know your positions or what you think about some of the bills, as he'll be tracking those things for sale.
Okay. Yeah. Okay, so I saw a question in the chat about my artwork. Yes, you are welcome to use it and that one doesn't have any slogans, so I think it will be safe to use that testifying as well. So you can probably save it at the if you got a if Diane could send me the agenda to you through email, you could probably just press on the image and then it will probably give you the option to save, and then you could save it and then put it in your virtual background. That's how we did it. We just save it. You saved it. You saved the image, and then you and it will save to your computer or your phone. And then when you go to your Zoom, you go to the virtual backgrounds and there will be a little plus sign. You press on that little plus sign and then you can add the image to your virtual background. So if anyone wants that, just let me or Diane know and I can send you a copy of the image. Please just know that this is my artwork. So please but just acknowledge that I'm the artist of it. Thank you.
Yes, thank you. Ivanova was really busy and has made artwork for each of the different advocacy days. So you'll be getting to see this each week. And on the advocacy day page on our website, where lists each advocacy day, there will be an agenda. And this is what the agenda is. So you can open that agenda, click on the picture and right click it to save it.
Yes. So it should be really simple for you to access that. Krista has said in the chat, Stacy says, love it, Ivanova. Thank you, Stacy. And Krista says, maybe a sale member can join the emergency leaders and policy education group sessions to help register people to show up for sale. It's great to have a self-advocacy organization dedicated to legislation. So thank you for that, Krista. And yes, I heavily encourage that. So if any sale members are able to attend those meetings, that would be great. I can't attend the one today because I have to get ready for my chapter meeting for Pierce County. So I won't be able to be there, but other sale members I'm sure will be there. Thank you. Any other questions or comments?
Yeah, wait, did someone say there was a people first meeting today at
Yeah,
1?
For Pierce County, there's a people first meeting for my chapter.
Oh,
Pierce
okay.
County.
Oh, for
But
Pierce
also,
County.
but Ben, I think it would be really good for you to attend the DD Ombuds Emerging Leaders. You can learn more about the bills. And
When's that?
also, that's at 1:30 today. And
Okay,
it's
and I can just go to the People First website for that?
yes,
Okay, I'll do
at
that.
1:30.
Okay, thanks.
No problem. Thank you. Any other comments or questions? Let's look at the chat real quick. Maybe Alice or Jessica could attend. Yeah, they could. Great job as MCs for today, Jeremy, Norton, Paul, and Ivanova Smith. Thank you. It's a lot of fun MCing. I'm honored to get to do the privilege of MCing, and Jeremy has done an amazing job as well. So thank you, Jeremy. We make a good team.
I agree. Thanks everyone for being here. We know you're very busy, juggling a lot of things. But yeah, this is how the work gets done, and this is how we change the system to work better. So thank you for showing up.
Yeah. And Stacy Dem has just put in the link for the People First Zoom room on landing page. So you can access that right on the link there. Thank you, Stacy. Oh, and Bean, thank you, Bean, for all the behind the scenes work that you've done. You're doing a great job. Thank you. And thank you to all our speakers today. We had amazing speakers that had really, and we had really great conversation from our participants. So thank you all for being so interactive. We love interaction and participation. Anything else? All right. Yeah. So, all right, I think people are starting to have to head out now, so I think we could probably end it here. Thank you everyone for joining, and stay tuned for our next Advocacy Day about employment. So take care everyone and have a wonderful rest of your day, and make sure to make appointments with your legislators or try to join any bill hearings that you're interested in, or join those awesome emerging leaders meetings. So have a wonderful rest of your day and thank you.